I will pose the first question. I was struck by the potential connections between your three talks. As we think about population growth, forces of urbanization, the impact of climate change becomes important. If you have a dense population, climate change, disasters can have greater impact. You may have challenges with food production. In addition, in terms of population growth, mental health issues could impact decisions about family planning. If you have too many children, you may have more postpartum depression. So I think there are connections between these three topics. Can you comment?
Sure, I'd be happy to, apparently.
Thank you, Kathy.
I mean, from my perspective as a mental health, a person that works in mental health, I think that part of that I began to address by saying with so many mental disorders actually beginning in youth, the more youth that we have, the more mental illness, of course, that we're going to have. So part of it is a population, relation to population. What I did fail to say is that we're also starting to do work in mental health that's related to environmental exposure and climate change, that there certainly can be impacts of neurocognitive functioning as well as, of course, what happens after post-disaster. So I completely agree they're quite related.
To add on that, I also completely agree that these are relating because having more children, that means there will be most of adolescents in town and cities without jobless, and many of the girls and boys will be engaged in different things which psychologically will impact themselves because they'll have to engage in different works like sex working and other activities which is really they don't want, but because of the impact of the population growth and the lack of activities for them to do, this will cause them having depression. And on top of it, we have disease like HIV, which are really grown fast, and most of our adolescents who had an HIV at a young age or even acquire HIV now, they live into depression. And we are seeing it in our clinics in Moshi, and even now we have started with door-to-door an intervention start on mental health from our previous study, which we have seen that these adolescents, most of them are living in daily depression and even having suicidal ideas. And for that case, we have seen that there is an importance of having an intervention start, making peer group and talking to them, counseling them, so that they could go out of this depression situation.
Mm-hmm. I do agree that the three talks are totally related. And the reason why I took the analogy between climate change and child development and discrepancy is because I like to throw the ball very, very large, and at least we'll run a meet in the middle. There's no way that for the next years to come that we should maintain silos. We need to start working together early on. And this campus, this opportunity of global health, bring us that challenge of addressing things in a complementary manner early on. So instead of saying, this is a problem, this is a problem, this is a problem, I think we're better off by all moving together further ahead.
Mm-hmm. Questions? Pop.
Pop guy again, Mental Health International. The connection I see with your three presentations is that the requirement that we have stronger health system. Mm-hmm. Mm-hmm. So my question for all three of you is, what's your suggestions about how we're going to finance health systems so that we can take care of all of these vertical issues you're interested in? Because that is kind of the big dilemma we have. So just your reflections, your thoughts on that, and how can we do what needs to be done, but at the same time, leave a legacy of strengthened health system.
As all the three are really related to health system, because in strengthening the health system, that means in one way or another we'll tackle the health of young children, we'll tackle the health of mothers, and as well as we'll support the mothers in even birth control and other things. And this will help them also to go out of depression. But how as a team, we have to work together, or how we have to do, that means this as a global team, we'll have to work also with the government team, the policymakers, because this is not a place-specific to be implemented, it's a country-wide and a regional-wide. So that means that's why we need also our fellows, health system people, advocate people. It's a kind of multi-group working, it's not an individual group. And that's why you see the three are related. That means one cannot move alone, we'll always need the other. And that's why in here we are interdisciplinary, different people working in global health perspectives. So from here we need to make a team of people who are interested in one of the area and another, and make a global team and look at how are we going to approach this and how best we should make it to make sure that we tackle this from different angles.
It's a bit hard to follow up on Blandina. However, I would say I think from the mental health perspective, it is related to health systems, but because of the hidden nature of the disease, that may not be sufficient. So that's why a broader community effort is essential. But I would also say that it does come down to resources, and in some ways, implementing policy and having political will to do it. I mean, the cover story in the New York Times on Sunday was how the country of Venezuela no longer has 85% of the psychiatric medications available, and they're attributing it to financial resources. And my question would be, well, do they have medications for all the other illnesses? And so there's this broader, so health system strengthening would be great, but there's also even a broader level than that, I think.
And also to minimally add to that point, we tend to make a joke of the Minister of Health being the Ministers of Diseases. So let's be careful on the argument of health system and strengthening, but let's look outside as well and start early on.
Question here.
My question is for Kathy. Hi. You talked about kind of the possible conflict in understanding of mental illness as being kind of culturally nuanced and trying to address that. And I was just wondering, and it also matches kind of the parallel with HIV as well, how you determine which things are kind of culturally universal in terms of what needs to be addressed in terms of mental health versus where you kind of run into that discrepancy between maybe what priority is for one country that may not be considered a moral priority in other countries, or there may be some conflict there.
Good question. I mean, we'd like to think that if we have effective treatments in one setting, they can easily transfer to another. But because of the cultural nature of presentation of symptoms and sort of how it's dealt with, it is necessary to adapt and tailor to various cultures and settings. However, that doesn't mean we don't have something to start with, that we don't start from scratch everywhere. But I also think that's why it takes time. I mean, it does take time to figure out how to transfer these, something that's effective in one place to another, or to develop completely new innovations.
All presentations were fantastic, and we've been talking a little bit about the healthcare strengthening. And I want to mostly point this one at Jaime, although there may not be an answer. Gavin Jaime earlier spoke about implementation at the public policy for healthcare strengthening. But Jaime, you touch about a problem that's much more global than one country's healthcare strengthening. You're talking about policy that would have to be very interdisciplinary to make climate change happen at industry level, legal issues, native populations that are living in areas that are remote. And I just don't know, is there what kind of funding and financing of global interdisciplinary groups is going on to address issues of climate change? Because again, if it is hard enough to find the money to finance your own country's healthcare system, how do we deal with the fact that we are dealing with a topic that has no borders? And whose responsibility is it? Is it the poor countries who are getting affected? Is it the industries in those countries? Is it the, where does that come from? And what can we learn from the healthcare strengthening process?
Isn't that called global health? And second disclaimer is I said I don't know something. But I think it forces us to be creative in the way that financing and aid has operated in the last 40, 50, 70 years. You have the example of China translating swiftly in front of us from being an aid recipient to a donor. So what are financing mechanisms? I think we all tend on the research side to say, where's my pot of money? And here I think what I would look forward is to see how can we embrace the training of new generation of people and talent to be able to address these problems without having the resources first. So I think, yes, that will always be part of the question, where's the money to do your job? But if you're only trained to do certain types of job, we will not be able to do the task together. So we need to start early on that.
Other questions? Over here, please.
Thank you very much. Very good talks. I'm Joe from Uganda. 2 questions, one for mental health. Mm-hmm. There is a typical way in which mental health is presented, especially when it comes to low-income countries, so HIV and the relation to mental health. I believe there's a new epidemic coming up which is being slightly ignored, which is substance abuse and how it's affecting young people. Mm-hmm. I wonder if that has translated into global health and interventions for that aspect. Mm-hmm. The second question I was asking is about young population growth. And I come from a country where 80% of the people are below 40 years of age. And we've had maternal birth rates of about 5 for many years now. Oh. And the interventions have always been family planning. And I'm wondering whether it's not some time to start thinking outside the box. Do we think we're going to control African populations with family planning?
Sure. I mean, I fully agree with you. And we often maybe should have noted more mental health and substance use. Certainly substance abuse and addiction are considered in the types of diseases that we're targeting, and is clearly increasing, not just with the number of youth, but the variety of substances that are being used and what people go to be able to get those substances. And of course, it has a great impact on mental health and all kinds of other aspects of health.
Yeah. Regarding family planning, yes, I agree. Not only in Uganda and Tanzania, all were around the 5-point-something birth for quite so many years. This has been dropped very, very slowly from 6-point-something, which has been there around the 1960s, up to now, where it's 5.2. And family planning has been there, and people has been talking about it. But how many people are using family planning? Taking an example of Tanzania, it was only 16% of women using family planning. And now, with modernization of family planning, implant intrauterine device, the use has been increased to 36%. That means they're still having 64% who are supposed to be really accessing the family planning, and they are not getting it. We have to go out and see what is the reason, is their access not reaching. And that's why I say we have 70% of population which is living in rural areas. And this family planning, yes, is well extended in healthcare facilities, in urban areas, and still women are accessing it. But how about the 70%? And that's why when you come, you find that most of these population boom up, which are in urban, people are coming from villages and from rural areas where they have to run to the town and the cities to get their livings and to get activity to see. We are seeing now that there is a trend of very many street children in our cities because they are coming from villages, they are coming into town. There is a lot of labor workers who are children, as well as lots of sexual workers, young girls. If you go to our cities in town, you won't imagine and you will not believe by yourself. But this is all because of, well, they run from villages, they come to town, they have to look their living. So we need to extend now our global perspective and go to those communities and make sure that the family planning is well known even to the communities. And that's why I say it doesn't go alone. You have to convince the woman to know that really the child will be living. That means there will be universal access to health. vaccination and other things. She will prove yes by saying that I can see children are going on well, they are not going to die, and the family planning will work.
Yes, Chris.
Thank you. Hi, Chris Paul, North Carolina Central University. Thank you for this great event and all that you've brought. I believe that climate change is the ultimate risk. There's lots of uncertainty, but there's broad impact. And each of you spoke of the proximate risks, situations, and decisions that are made by individuals, from the mental health crisis to family planning. So how do researchers and practitioners help bridge this gap between understanding and responding to such broad risks and uncertainty down to the decisions made by individuals?
I have a first step. And again, I don't know. You flowed me all the way from Peru to say I don't know 3 times. But I think it's being humble and honest to saying I don't know that forces you to think outside of the box. Because if we keep with the same models of doing things as business as usual, we won't get it. And we've all been trained to do proximate risks, single disease approaches, financing is a big problem. But yet the interactions between humans and human populations, ecosystems, and environment are much more complex than that. But we are not trained like that. And it takes us a hell of a lot of time to get to understand one field of expertise to talk to the other. And not everybody talks to each other. Only certain people take the challenges. Crazy me that I'm talking about something else that I don't know. But how do we enable those spaces, areas for communications and understanding to look forward, to look for different things of doing business? And that's, I think, a current dramatic change for today's way of doing things. And we have to do it. Otherwise, in 20 years' time, my daughter will be doing the same thing as I was trained to do things. It won't work. It won't work. And we have to start now.
Dr. Mteta.
Hello. Thanks so much. I have a question on the population presenter, Miranda, and also related to climate change.
Is the answer under no?
Okay. Yeah, I hope you'll have answers for me this time.
Go.
Well, I think, we haven't looked at the larger picture. Just imagine, we as humans, we are less than 3 million years. Out of Africa, we are talking about 100,000, just 100,000 years, when humanity got out of Africa. Here in the Americas, you are, I think, less than 15,000 years. But, the population outside Africa has exploded over the years. How are we addressing that one? Of course, maybe malaria helped a little bit to reduce the population in Africa, and the parasites in Africa were probably doing the family planning much better than what we are doing at the moment. So you tell me, in Africa we are less than 1 billion. But that's where everyone originated. Outside Africa we have more than, probably, is it 6 billion or 5 billion outside Africa? Mm-hmm. And this, of course, is the one which is, to some extent, affecting the climate also. It's we, the human activity. I think these are the issues in global health which we should also address. How do we look at it globally? Population control, worldwide. I think we haven't looked critically in this area in relation to climate change as well. And that's what I thought that we who call ourselves global health experts, we should be looking at. Population explosion outside Africa and its impact on the global climate. Thanks very much.
Jaime, do you want to tackle that first?
I'm swallowing not to repeat the same word I've used 4 times already. No lo sé. It is very interesting. It is very interesting because what you see as a demand from Africa of not being that many people yet having to come up with solutions for all these problems of all of us, It's like we in global health have to say that, well, that's not a part of my problem. It's not part of my problem. And again, when I asking and calling for thinking outside the box, it's because it brings all those domains of whatever I decide today on these proximate levels for here, how would that have a repercussion over there? Whatever the population movements that you're seeing, people moving to the cities, will have a repercussion on the mental health. Whatever the repercussions of population, society, interactions, decisions, policy, will have repercussions. But my plea today is to move us all from our single disease-based approach, because if we think health and we think global health, I want to avoid for the next generation of global health people to say, this is my condition, this is my expertise, but this is my contribution towards solutions for the global community.
Dr. Blandina, any comment?
Yeah, it's there. I can agree with Professor Mteta about population growth and climate, and that there is more than 6.5 billion who are out of Africa and also might be contributing to the climate changes. But before I go there, we have to look also at our African population, and where we see that the population is growing fast. We see also the climate changes. Taking into account, we are mostly using charcoal in cooking. And as far as the population grows, that means we need more trees to be cut off so that we could get firewood and we could get charcoal. And this is also impacting the population. And as far as population growth, we need more land to build houses and to expand. As a result, all those farming places where people were using to get food and own food now is occupied with the houses. And this also is a kind of a challenge in poor families, especially in rural. Now they're starting sending their lands which they could cultivate. And this is also a kind of an impact in population with the overgrowth. And so before we look outside Africa, we have to look also inside. We have also another kind of climate impact from growth population, because from one car in the city, now we have thousands of cars in the city. And this also contributed to climate changes because of pollutions and things which are going around. So this is also, we have to think that, okay, population is growing, there are impact in climate changes, there are impact in mental health, there are impact in other things. And that's why we think on how best to make it so that our future population can grow out of most of the tragedies which are going now.
Thank you. So thank you to the audience for your fantastic questions. Thanks to our three terrific speakers. Now on the schedule, we're going to have a short break before we come back to the next panel. Thank you.